This is episode 205, Exercise Pain Free. Welcome everybody to another episode here in Body and Mind Transformation by Custom Body Fitness. This is your health coach, Sandro Torres. And today we have an amazing interview. Her name is Eileen Kopsaftis. She is a BS, PT, FAFS, CMI, and NE. And she also is a best-selling author of 2 books, Pain Culture and Aging Cultures. She is a pain consultant, joy biomechanics and movement expert, and nutritional educator with more than 30 years of experience. She's a physical therapist, having completed over 2,000 hours of postgraduate education, including a fellowship in applying functional science with the Gary Institute. She also holds a certification in the MELT method, as well as a diploma in nutrition education. I hope you really enjoyed this conversation. I got a lot from her about how to avoid pain, how to alleviate pain, how to hire the right professional, how to look for pains, because usually the pain that where you feeling the pain is not where you actually have the problem. I learned that some medications also cause pains, as well as food and some of your mobility and function, how you use your body and your lifestyle also is a big cause of pain. So I think it's a great conversation. Please take your time to listen to this one, share it, love it, and comment. And don't forget to visit her website. Don't forget to visit her YouTube, and as well buy her book, because you are gonna be pain free once you start listening to this conversation and apply everything you learn, as well when you start reading the book and get everything you can out of the book and start applying it in your life. So without further introduction, let's listen to the talk. Welcome everybody to another interview here in Body Mind Transformation by Custom Body Fitness. Today, your health coach Sandro Torres is gonna interview Eileen Kopsaftis. Did I say that right, Eileen?
You did. Perfect, Sandra.
Thank you. Eileen, my audience wants to know more about you. Please tell me a little bit about you. Introduce yourself.
Well, for the past 30 years, actually 33, I think now, I've been working with people to help them to get out of pain and to restore health and to age without decline. My profession is physical therapy, yet I don't really practice conventionally. I've found that conventional treatment tends to miss the mark as far as addressing true chronic pain patterns in a way that makes a difference. There's a reason that pain management exists. People don't want to manage their pain, they want to eliminate it. And so that's my goal. My major passion is to erase pain from the world. Yes.
So you are a physical therapist, but
yes.
You didn't practice that because you noticed that the conventional way to do it is not helping people. Is that correct?
Well, I won't say it doesn't help people, because that would be a big bash on my profession, but I have found that it falls short more often than not. Some people don't understand this, but there's a huge difference between the skills of 2 clinicians. One could be focused on wheelchair fitting. Another can be focused on geriatrics. Another can be focused on pediatrics or hand therapy. So depending on your issue, it's going to depend on the training that person has had once they graduate and get their license. And I've spent 30 plus years learning techniques and methods that eliminate pain, that truly address the cause of the issue. We have to figure out what's causing the problem. And what I see mostly in a lot of clinic settings is when people come in with a pain, they're seen as a body part when they walk through the door. So if somebody has shoulder pain, they're seen as a shoulder. And so people tend to, the clinicians especially, tend to only focus on the shoulder. And they don't look below. They don't look at the thoracic spine. They don't look at what's happening in the pelvis or even the ankle. I've helped football quarterbacks restore shoulder function by restoring ankle function, never touch their shoulder, even though they had a diagnosis of shoulder tendonitis. So the goal is to see the person as a whole person and figure out where the problems actually exist, which are often not where the pain is.
This is going to be a very interesting conversation. You and we, you don't have to answer to me in this moment, so I'm just going to give you my introduction a little bit about it, and then we talk about a little bit about my issues. But before we do that, I want to get the most out of you so the audience actually get benefit from your talk. But I can give you a great example of myself. I had a tibia dislocation. So three of my ligaments were completely gone. So to fix the three of them. And because of it, I compensate with my right side.
Mm-hmm.
Sometimes I limp, but I'm so good tolerance with pain that I don't notice. I need to ask my question, what are you limping? And then I answer to myself, oh, because you're in pain. And that's when I notice. And I notice that I'm compensating. But sometimes I feel the pain in my leg. It could be in my quadricep. It could be in my hamstring. It could be either in the vastus medialis or lateralis. I can try to find where it is. But even though I feel it there, it's not there. Sometimes it's in my glute. Sometimes it's my spine. Sometimes it's somewhere else, but it's not exactly there. When I release that, the rest it seems to release. Anyway, the next question I want to ask you is, how do you started your career? To be more specific, not in the physical therapy, but more than anything, how do you find out that there were some kind of mistakes in the way approach pain, and the pain could be somewhere else but not there? How do you start that?
Well, in the very beginning of my career, I was introduced to a woman who was really skilled at manual techniques. And so when I graduated and got my license, I contacted her. She had a 3-week waiting list because doctors would send people to her specifically because she was so effective at eliminating pain. And so I asked her if she could aim me toward the coursework that actually helped people and steer me away from what would waste my time and effort. And so for 5 years, I invested heavily, more than my college education, in learning these techniques. And all of these, they were mostly osteopathic in nature. You know, doctors of osteopathy used to practice them. I think it's changed a little now. But what I found was the majority of the training taught that the pain is rarely where the problem is. And so I learned this very early on in my profession. For instance, if someone has an issue with abducting their shoulder, just bringing it up, and they've got some pain and something's catching in the joint, 9 times out of 10, when I assessed them, they had a sacral torsion. So there was something going on in the sacrum, and it was pulling on the latissimus dorsi muscle, depressing the shoulder bone, the humeral head, so that it was out of alignment when they moved in abduction. So I did a muscle energy technique to correct the torsion, did some strain and counter strain to calm down the latissimus dorsi, and voila, they would have pain-free abduction. So I saw this from the manual perspective. And that was the first 15 years of my practice, was mostly manual techniques. Fast forward the last 15 or 17 or 18 years, I've been very focused on teaching people how to train their body in 3 planes, because very often when they're doing exercise to a body part that's painful, so say somebody goes into a clinic with a knee problem, they're going to teach them knee exercises. The issue is, if the ankle has any lack of motion or lack of stability, the knee is going to take the hit. If the hip is lacking in any mobility, it's going to impact the knee in a very negative way, because the knee is just a simple hinge joint. It's just sort of bends one way, like the hinge on a door. And the hip above is the second most mobile joint in the body, but it's also weight bearing, unlike the shoulder. And then the ankle is the foundation. And I learned there is so much that goes on in the ankle that causes a ripple effect all the way up to the neck and back down, just from heel strike to toe off in a simple step. And so if that ankle's not correct, nothing above really can be. And I cannot tell you how many people I have been able to help get out of pain because we restored ankle function. It didn't matter if their pain was in their elbow, their shoulder, their neck, their low back. Now, that's not always the case, but more often than not, if they had a history of an ankle sprain or a lot of sports injuries, that kind of thing, we figured out that that was a big part of the problem. So I found that this movement training was kind of like the holy grail to teaching movement, because in my profession, again, people are seen as a body part when they walk through the door, and exercises always focus on that one body part, which doesn't always resolve the issue because it's not always where the problem is.
Have you tried to approach doctors and other physical therapists and talk about this? And how do they take it?
So I was always seen as a little bit different in my profession. Right off the bat, even with the manual techniques, I was told by a supervisor that if someone came in with a neck problem, I couldn't look at their back, which really disturbed me, because if you know anatomy, the spine really is one piece of anatomy. There's no little walls between the different segments. And so I sort of tongue-in-cheek asked her, well, how low can I go? And she said, oh, maybe C4, C5. I mean, it was just kind of crazy, her answer. And so I was really kind of fighting against the whole establishment for quite some time. But the fact that the people I treated got better, and I didn't have a cancellation rate, because people got better, they came, they knew they were going to get better. They weren't one of 4 people in a gym being seen by the same therapist and an assistant and kind of watched, but got their own ice pack out of the freezer, that kind of thing. So I was actually bringing in the most revenue to the department. So they stopped bothering me after a while and just let me do my thing. But it is, I've had conversations with physicians who weren't quite sure how to take me when I would, I'd have to call and say, no, their problem's actually here. And because they have Medicare or they have workers' compensation, we have to make sure the prescription says where the problem is, because the clinic won't get paid. So it's been a battle for many, many years. It has been, yes.
It's interesting how the system that is already in place ties many professionals to help other people become better. And the reason why I tell you this is because I have interviewed other people and I do my own research about how many diseases and problems are out there. There is a solution, there is a cure, there is a fix. They're not popular in the main hospitals and medicine because they have the cure. I mean, it's a cure and they don't they don't seem to understand that, and they need to follow a protocol. And the protocol comes from above, and then you enter into politics and all that stuff. But I'm
Yes.
glad you're helping a lot of people. Thank you so much. Okay, one more question before we enter into the real questions. Give me some of your best success of people who you have helped and they didn't believe they're gonna feel better. What problems they had? How do you help them? And how do you succeed in that area?
Mm. Well, I could tell you story after story. We'd be here for quite some time. But the first one that comes to mind is an elderly woman that I worked with who had shoulder pain, both shoulders. She had been getting injections in her shoulders for 5 years regularly. Now, I was a little bit shocked, and I have to be very careful how I present myself and be professional, but I was very disturbed when I asked if she'd ever been recommended to see anyone for this pain, and she had not. So the healthcare professional who was providing the injections never recommended anything else. Now, this woman was very limited in how much she could abduct her shoulder. And when I treated her, she definitely had sacral issues going on. We corrected those. We calmed down the lat dorsi. And she had pain-free restoration of motion, so much so that her eyes just practically bugged out of her head. She could not believe the difference. So it's now that doesn't happen with everyone. I'm not even going to pretend that it does. There are times where there's a lot of other things that need to be done. But for the most part, when you are seeking the cause of something, you're much more likely to succeed than if you're just treating the symptom.
Yes.
And the medical world just wants to treat symptoms. And that's where the failure lies. And when it comes to chronic pain, there is never going to be this evidence-based protocol for chronic pain. It will never work. And the reason for that is each person is absolutely individual. I'm sure every person you've worked with to help them to lose weight and get fit and had a very different personality, a very different background, a very different medical history, a very different history of even the nutrition that they ate as they grew up, their ability to handle pain or stress, or just every person is unique like a fingerprint. And so when you go to address someone who has a pain issue, that has to be taken into account. They can't be some protocol on a piece of paper that says, oh, you have pain here, so let's do this, 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 and this. Because it's going to completely miss the mark. I've worked with some people who've really needed to work on strengthening because the fact they had low back pain is because their gluteus maximus had just completely shrunk and lost all power and ability because they've been sitting on them for 20 years. So, versus somebody else who needed to learn how to get a three-plane motion in their pelvis to restore mobility. Each person is unique and individual. But the cool thing is, Sandros, is that there is a very easy way to assess somebody's mobility. It's just 6 movements. You do it on the right side of the body, the left side of the body, and it will literally demonstrate 66 different joint motions throughout the body and help you to figure out, okay, that's not working there. I bet that's why there's pain here. And it takes about 20 minutes to do. It's not like I'm spending 2 hours, looking at people from head to toe and testing every muscle. And that's another issue. Not to get off on a tangent, but manual muscle testing. When you go to see a PT or most people, even maybe an athletic trainer, they're going to do manual muscle testing. Now, that's only good if there's nerve injury or some other issue to let you know, wow, that's really weak. Because the quads function very differently when you're squatting versus sitting on a table and straightening your knee. So you're not going to get an accurate picture. You've got to walk the person through motion.
So that's actually lead me to the next question. But before I ask you the question, I want to introduce a little bit of info into that. One of the things that I'm concerned about referring my members to the doctor, not any doctor. There are good doctors out there. With this one,
Yes, I agree.
same thing that you mentioned before. That doesn't mean that the whole system is wrong. There are actually absolutely great doctors out there. They have
Yes.
helped me. They have taught me a lot of things, and I follow those doctors. But if you send a person to a doctor that just follow the protocol, it's difficult to get the right diagnosis. Anyway, I hesitate to send our members to regular doctors when they have some kind of pain because they're trying to inject them, medicate them, limiting them, and do things that doesn't really help. When sometimes it's only a muscle trigger point, or problems like you mentioned that you have the pain in the shoulder, but it's coming from somewhere else, which I have some experience, but I'm not the expert on that area at all. So when people tell me, I have lower back pain, I feel this and that, I can only guess and say, yes, you have muscle trigger points, and I believe it's in this area. Go find a physical therapist, go find a massage therapist, go find a chiropractor, somebody who can pinpoint where your problem is, fix it, and you're gonna be fine. Based on my experience, and you probably will know more about this, it's difficult to get muscle strain, a tear, how people call it. It's more known as a tear for people, by most people. I know they're common on your vastus lateralis because I had him and some of my members had him. That's when I feel him the most. When I found out the most. Anyway, I have a member right now that she had a lot of shoulder pain. She went to the doctor, and once she went to the doctor told her that it was a muscle strain, a tear, and that she needed to rest, which I won't disagree. I believe for a tear, you must rest and needs to heal before it gets worse. Do you think that was a good diagnosis in the shoulder, and actually the tear is in the pectoral, in the chest?
Well, it would be kind of unprofessional of me to really give any specific response to that because I haven't seen her. I didn't, watch her go through movement. I didn't palpate her. I didn't assess her. I do agree that if a muscle is injured, it is important to allow it to heal. That's critical. Now, I think if we preface that with how does the injury occur in the first place? Now, unless somebody is in an impact sport like football or soccer where they're going to actually get hit by someone, injury more than often occurs because the person hasn't trained in a way that ensures they've got full three-plane motion throughout their body. And I'll give an example. Where I learned this three-plane functional training is through the Gray Institute. Now, the Gray Institute has been around for over 50 years. It was founded by Dr. Gary Gray, who's literally nicknamed the father of function. And he's extremely brilliant in his understanding of how human anatomy actually works in real life. Not just, most of us understand anatomy based on cadavers, dead people. Now, dead people don't move. And just because a muscle attaches here and here doesn't mean that's the only way to train it, because it might perform completely different in a different context. Like walking, hamstrings literally help to extend the knee. But most people, when they train the hamstring, they're bending the knee. So there's a lot of authentic movement that people would benefit from learning. But the reason I bring that up is because they train a lot of professional teams, a lot of athletes. They're big in that field, and they have like zero occurrence of ACL injury in their athletes. So a lot of the times injury occurs because the person is lacking in some mobility or stability in the big rocks of the body, like the ankles, the hips, the trunk. So, that's critical. I worked with a lot of teenage athletes when I was in a clinic setting near a high school, and their parents got to the point where they'd bring their child in and say, I told them they couldn't go back to the game until you assessed them, because they learned if they had an ankle sprain from 2 years ago that the coach just said, you're fine, no more pain, no swelling, you're good, you're ready to go. But then it was a softball pitcher ended up with a shoulder problem because that ankle was lacking some part of its function. And so the parents actually learned to bring their kids in before they got injured again. So it's really critical to ensure your body's functioning properly so that you don't get injured. Prevention is really critical.
Okay, now, does pain mean injury?
Not always. It can be delayed onset muscle soreness.
Okay, that makes sense, but there is any other pain that can be out there that people perceive as an injury. Does that pain mean injury, or they just need attention? Of course, they need to be diagnosed. With this in mind, I'm not saying that not to pay attention to it, but many people do get afraid once they get some kind of pain.
Yes.
What would you say about that?
Yes. So very often, not moving is the worst thing to do, because now everything is just going to freeze up. You're gonna lose more mobility. You're gonna get weaker. So a lot of the times when I work with people who have pain issues, people are very active nowadays. You've got a lot of older people playing pickleball and all of these other very physical sports. And so, they're like, yeah, my knee's been bugging me ever since I started pickleball. Well, that didn't mean the knee was injured. It meant that the hip above was not doing its job and the ankle below wasn't doing its job, depending on the person when I assessed them. And so we didn't tell them to rest and stop doing anything. What we did was we trained the body to restore what was needed so the knee would be happy again. Now, of course, going out and playing pickleball and causing more pain, initially I would say, let's just not play for a couple of days. Let's do this. Let's see what happens. So, not moving is not always the best solution. Movement, motion is lotion. Moving the body, the muscles really thrive on that. The fascial system thrives on motion. Sometimes people can have pain just because they're dehydrated. A lot of people are not drinking enough water. Muscles are 78% water, and they will scream for water. Some people get muscle spasms just because they're dehydrated. So
you telling me, let me put that in my words. So you're telling me that if people are experiencing pain, and it's because an imbalance in their body, it's okay for them to move, but they need to find the cause as they're moving to fix the problem.
yes.
Okay.
Yes.
This is a similar question, which I believe you answer it, but I want people to hear it. Is it okay to experience pain? Do you experience pain? How do you deal with it?
Right. So I think that's a really big question. And the answer is it depends. Because if someone has structural damage going on somewhere, and now they're using that body part in a way that just causes more damage, that pain is a warning sign. It's telling them we can't, we don't want to do this. There's injury here. There's something going on. We can't continue with this. Now, if someone is simply experiencing delayed onset muscle soreness, and that can happen kind of pretty strongly for some people if they haven't used muscles in certain ways for a long time. And so just moving around is, I'll give an example. My husband does a very physical job. And when he first started that physical job, he could barely get out of the car when he got home. Everything hurt because he had just worked like a dog for hours, lifting lots of heavy things. And it took him a couple days to recover, but it didn't mean he needed to stop moving and just lay in bed. So it really depends. It depends on what's going on in that person's world. And I also say there's a difference between pain and discomfort. So for instance, and this might help,
Nice.
okay? If someone has pain when they're standing, say they have back pain when they're standing, and I will say, okay, no matter what you do, if you're standing, you have back pain. Yes. I ask them to give me a score. That 0, no pain at all, 10's the kind you're screaming and begging to go to the hospital. So maybe they'll say it's a 3. Okay, let's do some training, and you tell me if that 3 increases. If it doesn't increase, then what you're doing is not causing harm to the part that's not happy. But you're going to work on the body parts that need to be better in order to resolve the pain. Does that help?
Yes. Let's say like the athlete who's playing softball and is throwing the ball and the shoulder hurts because of the ankle. Let's say he completely ignores the ankle and continue doing what he's doing. He's going to be in pain.
Yes.
Is besides the pain itself, there is anything worse that can happen?
Severe injury to the shoulder joint. Yes, absolutely.
Injury.
Ligamentous damage, tendinous damage. Yes.
Okay, so they need to take care of that pain right away so there is no other issues in the future.
Yes. Just icing it and resting it is not a good idea because you've got to restore the ankle function so that the shoulder can perform properly without pain. I had a football quarterback. He was 22 years old, rock solid muscle from his nose to his toes. Nothing was wrong with this kid when he came in. Now I say kid because of my age. So he comes in and his diagnosis was shoulder and elbow tendonitis. So I assess his shoulder, I assess his elbow. I don't find any lack in range of motion or strength. So I'm like, well, what's going on? Why are you here? And he said, when I do the 3-hour 3-man throws, I have to stop early because the pain occurs and I can't keep throwing the ball. So I said, show me how you throw the football. And when he did that, I saw how unstable his ankle was. So I told him, I said, when you go to release that ball, because the ankle is not stabilizing your body, your shoulder is getting yanked abnormally every time you release the ball. So that's why it's getting irritated, it starts to get inflamed, and it starts to be painful. So let's restore ankle function. And because he was young and fit and strong and healthy, 3 or 4 sessions, we got that ankle nice and stable. He could do 3-hour 3-man throws without any symptoms in his shoulder. I never touched his shoulder. But had he continued and ignored that, he could have ended up with some damage to the shoulder joint.
Wow. This is very interesting, Eileen. You are who I've been looking for. So I'm going to tell my members to visit your website and go do the tests. I have a couple of members who have those kind of issues, and I want to refer them to somebody because I can, for example, myself, I study myself very well. And I think it's because I'm conscious of that injury, the only injury that actually I have, and I'm aware where pain is come from, and I work on myself every week to avoid injury. That doesn't mean that I'm perfect. I'm gonna go and do your test as well, but I do a lot of stretching and massaging to keep me from pain because I notice that helps a lot.
Mm-hmm.
What would be a recommendation that you give to people who exercise to avoid pain and these kind of injuries from mobility and muscle trigger points?
So this kind of flies against conventional fitness industry training, but you're much better off to be doing weight-bearing exercises than laying down on the floor doing crunches to get those six-pack abs, because the human body is designed so that the abdominals really love rotation. They get switched on with rotation, but they also enjoy getting longer under tension. So in other words, standing up and reaching up and bending back and rotating is going to get those abdominals so much more engaged than just doing some crunches on the floor. So doing things that where the body is weight bearing and more whole body movements, because a lot of the times we isolate our body parts to, and as I said, it's based on studying cadavers. So we think, oh, the muscles attach here and here, so let's shorten it with a weight and let's get it stronger. The problem with that is, in the context of human movement, the body is kind of freaking out, going, why are you forcing me to do this by myself? How come the rest of the team can't join me in this? And I'll give a simple example, Sandra, so I think you'll like this. So if you're in an airplane and you go to put a suitcase up overhead in the overhead compartment, do you stand there and go, okay, I better only use my triceps. I've got to keep my elbows right next to my ears. I've got to keep them at 90 degrees, and I can only use my triceps, and I can only push up. Do we do that? No. We do this. We squat down, depending on how heavy the suitcase is. We squat down to load max, which is our power source, and we push through the floor with the amount of effort that's required to get that overhead. So the triceps are really doing very little. But yet, when we train them, we isolate them. And so now we're at risk, a higher risk of tendinitis, tendinopathy, tendinosis, because we want to be doing whole body movements, letting the whole body be part of it. That is probably the most important thing for people to understand, so that they radically reduce the risk of injury. I worked with a lot of people who spent a lot of time in gyms, before and after work, and they tend to come in with tendinitis because they're isolating body parts, and yeah, it's not the best.
Okay, there is anything that I haven't asked you that you think is important for our audience to know?
Well, I'd like to reinforce the fact that people need to know they're a whole body. They're not a body part. And it's very important that when they go to see someone about an issue, that they're seen as a whole body. If that person sees them as a body part when they walk through the door, that person is going to be limited in how much they can help them.
Now that sparked my brain to another good question. How do you think people can spot a good professional who can help them with their pain?
Yes, that's a very good question. I actually have some online content that I say the good questions to ask. So the first question to ask is, how long have they been doing what they're doing, and how many people have they helped? Because it doesn't matter how many letters are after their name. If they haven't really helped a lot of people, sometimes people write a best-selling book, but they're not working with the patient population. So everything in the book is theory. And if they're seeing you as a body part, they're going to be limited in how they can help you, no matter how expert they might seem. You really need to understand the connection between everything. So A lot of the times I will tell people to seek out specific understanding that people have. Like I mentioned the Gray Institute earlier. If you can find somebody local who's been trained by the Gray Institute, that would be ideal. If you go to their website, they actually have a locate a clinician, I think at the top. So you can find somebody, and I usually say they have a lot of certifications. The most important one, which is their highest level, is FAFS, which stands for Fellowship in Applied Functional Science. I've graduated from that myself a couple of years ago. It's kind of like a PhD in human biomechanics. I mean, it can make your head hurt to take it. It's 40 weeks of training, but extremely valuable. So if you can find somebody trained in that, that would be ideal, because they're going to see you as a whole person. They're going to understand the context of human movement. Yeah.
Okay. Give me 3 things that people can do to be pain-free for people who are active. They can do it their own to be pain-free.
All right. Well, again, it depends on what's causing their pain. So I find that a lot of the times food plays a huge role in chronic inflammation and pain. I do have a nutrition educator diploma, which was a 900-hour program that was not industry funded, so there was no bias or conflict of interest, and we went only by the clinical studies. And I've helped people resolve chronic pain just by changing how they feed their body. So paying attention to that is key. If someone is eating a lot of foods that promote inflammation, it's going to be very hard to address the pain in any real way. There is also the water that I mentioned earlier. If you're not consuming enough water, those muscles can really spasm. They're like crying out for water. They say, please, we're dehydrated here. It can also impact your workouts and your ability to do things, because fatigue and headaches and all kinds of things can happen because of not drinking enough water. And then I think if the person's experiencing pain, understanding how to move in a way that doesn't elicit the pain in repetition. So what I mean by that is, remember I said earlier, if somebody had back pain, it was a 3, and we did exercises and the pain did not increase. Mm-hmm. The pain was just because they were weight bearing. So the movements themselves did not exacerbate the problem. But if someone has pain somewhere and you're doing a movement, and every time they do that repetition, it's kind of like, ouch, but it's this internal, they're going to bite the bullet because no pain, no gain. So they're just going to keep allowing that pain to occur in repetition. That is not their friend. What I teach specifically is how to modify a movement. And I'll try to give a really simple example. So say someone has pain when they have one foot forward. Say they want to do a nice stride position and they want to reach up overhead. Now, what we discern is, in those 3 planes of motion, which motion is their strong plane of motion that their body likes, as opposed to the ones it doesn't like. And so we might change the foot position. They might prefer a frontal plane modification, so going wider or going narrower. Or they might prefer a transverse plane modification, which means let's try turning the toes out or turning the toes in, and then they may be able to perform that with no problem. So what you do is you perform the motion with the modification. As you train the body, the brain doesn't have to try to protect you from you, because the brain will cause us to cheat because it thinks it has to protect you, and it won't tell you you're cheating. So if you've got pain with every repetition, the brain's trying to figure out a way to stop that pain. And so it's going to cause you to do all kinds of funky things. You're going to rotate, you're going to side bend, you're going to extend, you're going to flex, you're going to do all these funky things that you don't even know you're doing. So now what you're doing is training in dysfunction. So if you modify the movement to eliminate the repetitive pain, the muscles start to train properly. The brain doesn't think it has to protect you anymore. So you're now training the muscles in the right pathway. And now you start to see progress and success. And before you know it, you no longer need the modification, because you've restored the ability
So the
of those muscles and those joints to work.
So the modification is only until the brain.
It's temporary.
It's
Yes.
temporarily until the muscles work in conjunction to make that movement where the pain is when the pain is triggering.
Right, right. For instance, I had a young guy come into the clinic one time and he had knee pain. And I figured out when I had him go forward into kind of like a half a lunge on that knee, if he rotated to lengthen the glutes, he didn't have knee pain. And he's looking at me going, okay, how did you do that? I said, well, I didn't do that. That's body mechanics. It looks like your hip is not helping your knee. Let's strengthen your hip so that the knee gets what it needs when you're lunging. And we just strengthened the glutes, and his knee was a happy camper lunging after that.
Nice.
But just lunging without switching on the glutes with the rotation or side bend would have just continued to aggravate the knee.
Yeah, we need more people like you. I hope you.
Well, that's why I do what I do. That's why I'm on this podcast. I want people to know this stuff.
I'll refer I'll refer people to your website, but I wish you were closer here so I can refer my people to you. One more question, and we're gonna get a little bit more into you. What do you think about deep tissue massage, sport massage, and chiropractor adjustments?
Well, that's another really big question. So chiropractors are like PTs. Their skill is going to differ between clinicians. Some of them want to have you come in 3 times a week for the rest of your life. Others have a lot of other training, and they're going to really go after finding the cause and helping. And then you've got all the ones in between. So again, it depends. What is their skill? You know?
So you telling me that the chiropractor adjustment and massage, deep tissue massage, are helpful with the right professional?
Correct.
Okay. Now, tell us about where people can find you. Give us your website, Facebook, Instagram, and everything where people can go and find more about you.
Okay, so probably the best website for them to go to if they're interested in doing the assessment, the movement assessment, and beginning the training, that's free. And that is at my website, mwpprivateclub.com. Now, MWP stands for Move Without Pain. So it's mwpprivateclub.com. And you'll see at the top, it says try a class for free. And you can sign up and get access to the video to assess your body in 3-plane function. It's about a 23-minute video. There's a document you can download and document your findings. And then there's a workout that you can learn as well. So for those who are in pain and want to figure out where the culprits are, that's probably one of the best things for them to do if they don't want to buy the book and read the book. Now, I don't teach exercises in the book because you can't learn an exercise from a still picture. It's just not. I've seen people, it goes all kind of ways of wrong when people try to figure out how to do an exercise from a picture. And so that's why I've got all the videos. I've got a YouTube channel. If they just type in my name, they'll find me on YouTube. But you've got to see movement in order to learn movement. And I teach a lot of modifications. When I demonstrate a motion, I say, if you've got pain here, try this, try that. So, you can't put all that in a picture on a book. So that's very important as well. Yeah.
Okay, I know you have 2 books, Pain Couplets and Aging Couplets.
Yes.
Tell us a little bit about those books and where we can get those books.
Okay, well, they're both available on Amazon. The Pain Culprits I wrote because I was tired of people not understanding the connection in their body. I've also got chapters in there on medications and their side effects, medications that cause pain that people are completely unaware of, like statins. Statins are a huge cause of pain for people that they don't understand.
Can you mention some of those medications that cause pain? Is it possible?
Off the top of my head, really the statins is the first one that comes to mind, because There's even a risk of something called rhabdomyolysis, which is breakdown of muscle tissue, which is extremely severe, not a side effect you ever want from a medication. So I've got those chapters in the book on those topics. I also have a chapter on knees, hips, back, and shoulders, and how everything else is connected, including connecting the hip function and pelvic floor function if people are struggling with incontinence, because a lot of the times that's connected. And I have a chapter in there on how to find a clinician and what to ask. So there's a lot of information in there. I really want people to know how things are connected. There's also an entire website that people can access through the book that has lots of resources that I didn't put in the book because the publisher said if the book was too long, nobody would read it. So I put all the things I wanted to put in the book on the website, and it's free. You don't even have to buy the book to go to the website. So
I'm going to give you a book. I think I learned a lot from you. And the other book, Aging Culprits?
Yes, Aging Culprits. So half the people who come to me want to get out of pain. The other half don't want to end up in a nursing home. And so I've spent many, many years working with older populations. I've seen people over 100 years old get stronger doing squats and parallel bars. The whole things that we believe about aging is not true. Decline is not inevitable. It is what we do, not the number of candles on our birthday cake. So I wrote that book. The first one, and you would love this, Sandros, the first chapter is on mindset. Because if you believe you're supposed to decline, you're right. If you reject the narrative that we've been fed through mainstream media for years and say, I don't need to decline, I can do something about this, you're right.
Yeah.
So, mindset is huge. I've got a chapter in there on joint pain and why we need to keep stairs and don't buy a house with no stairs so that we can age in place because we're expecting to decline. Because I cannot tell you how many people I've seen decline when they moved out of the house that had stairs. They needed the stairs to stay active. And when they lost the stairs, they lost strength and function. I've seen it over and over. So there's a lot of good chapters in there. Yeah. Incontinence and osteoporosis and osteoarthritis. Yeah.
Nice. Now that we are talking about that, there's two things that I'm thinking about. One, I want to ask you, I don't know where I read this. I don't remember where I read it, but I read and I wanted to ask you if it's similar to statins. Antibiotics do weaken your tendons and ligament, and there is a higher percentage of you risk of you getting a tendon or ligament ripped when you antibiotics, of course, when you are not, compared to when you are not. Do you know anything about that?
I wrote that book back in 2020, and I didn't come across that specific information at the time I was researching for the book, but I'm sure there probably are some updated studies that might show that. Also, and your audience might really benefit from knowing this, NSAIDs, right? Mm-hmm. Non-steroidal anti-inflammatory drugs, which a lot of people take for joint pain and muscle pain and all of that, they've actually been shown to inhibit. Now, they did a study. This was based on quadriceps muscle growth and strength. So it was very specific on that one set of muscle, but it doesn't mean it doesn't impact others. They saw that taking the NSAIDs inhibited muscle growth with the training for quadriceps strength.
Wow. That's a good note right there. Thank you. And another thing that you're talking about the stairs, and you probably know this already, you should say it differently. People who retire die faster than people who don't.
Because they stop moving.
They stop wanting, they stop reaching, they stop progressing, they stop smiling for the challenge. As humans, We need a challenge. And that's one of the things that I mentioned to our members of Custom Body Fitness. Think about the weight. Don't think about it as painful. Don't think about only your results. Think about a challenge. You need a challenge to grow. You
Yes.
need a challenge to become better. You need a
Yes.
challenge for you to handle other challenges in the
Yes.
future. When you become stronger here, is not only about transforming your body and just doing the repetition and lifting that way. Is you becoming stronger, strong enough to be able to face the challenge and things
Oh,
that
yes.
we had a member a long time ago, and I remember I completely remember her. There's many, but I remember her because she came to my office crying. She said, I wanted to tell you something, Sandro. And the husband used to abuse her in many ways and verbally. She was tired of it, but she didn't mention nothing on that one of the in any of our assessment. But in that day, she came and she said, I wanted to tell you something. And she said, I'm asking my husband for a divorce. And I was wondering why she was telling me that. And finally, she said, you help me with that. And I say,
Mm.
when did I give you advice to get divorced or something like that? And she started telling me it's because all the weightlifting I be doing here. I didn't
Mm.
want to take the challenge with my husband, and I didn't have the strength to go and confront him and say, this is enough, no more abuse.
Yeah.
And that touched my heart. I said, like, it just made me think how those small challenges, when people don't want to lift those weights and they're afraid of lifting that weight because they don't think they can do it or because it's going to hurt.
Mhm.
And when they take that challenge, they become mentally strong to take other
Yes.
challenges outside of the weight.
Yes. Yes, absolutely. And thank you for sharing that. I got chills. I've actually led a support group for women who've been abused, and I've led it since 1999. So I'm very familiar with that population. Yeah.
Nice.
And
I
you're
think
right. I think that's beautiful. Yeah.
um I I would love to have another interview in the future and talk about these things more specifically, because right now we focus a lot on pain, but I think you have a lot of knowledge about the mainstream medicine, a lot of knowledge about mindset. You have a lot of knowledge about humanity just in general, spirituality, and things that matter. That pain doesn't only come because of a dysfunction of the body, but also psychologically, food and traumas and other things that we not aware and we don't want to take into considerations because we think
Yes.
everything is physically. And what the doctor, and when I say doctor, I don't want to generalize that into every single doctor, but more than anything, the main system that let us believe that there is only one thing, and medicine is going to fix it, and surgery is going to fix it. And in reality, it's all this that we have.
Oh, yes. A history of trauma can certainly cause chronic pain issues. Yeah. Yeah.
Anyway, thank you so much, Aileen. I really had a blast with this conversation. I think you're very knowledgeable. Please share those links with us.
I will.
Your,
Yes.
your YouTube, your website, and everything where we can find you. Everybody, please go get the book. I recommend the aging one. I think it's the one. If you're a professional, get the pain one. If you want to stay young, get the aging one. I'm gonna get both of them, but first of all, I'm gonna read the one in pain. So thank you so much, Aileen. Anything else you want to say?
Yes. Yes. No, just I really thank you for this opportunity, and I really hope this information gets people thinking and helps them get out of pain and age without decline. That's my passion. So
Thank you so much, Aileen. For now, I say bye. Thank you, everybody. Thank you for being with us, for continue following us. And that's it for today. Thank you.
thank you.
So that's it for today. I hope you got a lot of information. I could dig more into Eileen's knowledge because she's very knowledgeable in many areas, not only in pain, but also in other areas. And I honestly tell you that I wanted to invest more time, but it will be a very long conversation. So she's going to be invited to that program again. So wait for her second interview. We're probably going to be talking about aging and traumas. I would love to hear what her insight about those two and learn from her more so I can apply that in my life, and also we can help our members here in Custom Body Fitness, and you also get benefit from this talk. So thank you so much. For now, Sandro Torres says bye. Remember to share, like, and we will love your opinion. Stay close to God, mentally and physically healthy.